Welcome to today's deep dive. We are jumping straight into, well, one of the most talked about trends in regenerative aesthetic medicine right now.
Oh, absolutely. It's everywhere.
Right. I mean, you might have seen it making these viral headlines lately under the slightly startling nickname of salmon sperm
Yeah,
facials.
that name definitely grabs your attention, doesn't it?
It really does. But we are, of course, talking about polynucleotides. And to unpack this properly for you, we've brought together just a fantastic stack of sources today.
We really have some great data here.
Yeah, we're looking at comprehensive clinical protocols from places like PHI Clinic, Dr. Chait clinics, alongside treatment insights from Bioresis.
And we also have some heavy-hitting dermatology journals in the mix, too.
Exactly. Journals that really detail the precise cellular science behind this whole trend. So our mission today is highly specific.
Very targeted.
Because, while the internet is completely obsessed with the initial glow and, let's be honest, the shock value of these treatments,
The shock value is real.
it is. But we're going to look past the hype. We are going to uncover the exact recommended maintenance schedule required to preserve those results.
Which is really the most important part.
Right. We're specifically looking at the critical 6 to 12-month window. And more importantly, we're going to dissect the cellular biology of why this specific timeline actually works.
It's all about the biology.
Okay, let's unpack this. Think about what happens when your smartphone starts acting really sluggish. You know what I mean?
Oh, yeah. We've all been there.
Right. The battery is draining by 2 in the afternoon. Apps are freezing. The screen is lagging.
It's the worst.
It is. But you don't usually just throw the phone away and buy a new one.
Right.
And you certainly don't just put a new case on it and pretend the phone is fine.
Right. A new case doesn't fix the battery.
Exactly. You plug it in, you connect to Wi-Fi, and you download the latest software update. You rewrite the code, basically, telling the operating system how to run efficiently again, clearing out the bugs from the inside out.
That is a brilliant way to frame the paradigm shift happening in aesthetics right now, actually.
Yeah.
I mean, the industry is moving away from merely masking the symptoms of aging and moving toward actively reprogramming cellular behavior.
And that reprogramming, it requires a physical messenger, right? Let's
Yeah.
contrast this briefly with traditional cosmetic injectables, just to set the stage. Things like hyaluronic acid fillers.
Okay, yeah, good comparison.
Because with a traditional filler, we're dealing with a passive intervention. You place a gel under the skin to add volume to, say, a hollow cheek or a thin lip.
Right, just sits there.
Exactly. It essentially acts as an architectural implant. It
Yeah.
takes up physical space. But polynucleotides, they're highly purified DNA fragments.
They don't add physical volume at all.
Right. They upload new biological instructions to our aging cells.
What's fascinating here is the precise receptor mechanism that makes those instructions readable to the body.
Okay, break that down for us.
So these polynucleotide chains are typically derived from trout or salmon.
Hence the nickname.
Exactly.
Yeah.
But they use them specifically because their DNA structure is incredibly compatible with human tissue.
Really? Fish DNA.
Yeah, and once it's ultra-purified to remove any proteins, it carries just a negligible risk of an immune reaction.
Okay, that makes sense. So no allergic response.
Right. And when these fragments enter the dermis, they don't just float around aimlessly taking up space like a filler would.
What do they do?
They actively seek out and bind to specific receptors on the surface of your skin cells, specifically targeting the fibroblasts.
The fibroblasts. So those are basically the cellular factories of the skin, right?
Exactly.
The entities responsible for actually manufacturing our structural scaffolding. So how does binding to a receptor on the outside of the cell change what the factory is producing on the inside?
Well, it triggers a massive biological cascade.
Yeah.
You see, as we age, our fibroblasts become really sluggish.
Like the old smartphone.
Exactly. They go into a sort of semi-dormant state, producing less and less structural protein each year. But when the polynucleotide binds to the cell's receptor, it sends a powerful biochemical signal straight to the nucleus of that cell.
Kind of forcing it to wake up.
Yes, forcing it to shift into high gear.
Yeah.
The fibroblast immediately starts ramping up the production of collagen type 1.
And type 1 is the rigid one, right?
Right. It provides the rigid tensile strength of the skin, and it also ramps up type 3, which is the supple, bouncy collagen associated with really youthful tissue.
Wow. Okay.
Plus, it stimulates the production of new elastin fibers.
Which perfectly explains why the product you inject isn't the final result. I mean, you're literally forcing your own body to manufacture the result from scratch.
Precisely.
But, manufacturing structural proteins isn't an overnight process. Which brings us to the findings in that 2024 PubMed review from our stack of sources.
Yeah, that review makes it very clear that patience is a biological requirement with regenerative treatments.
You can't just expect it to look perfect the next morning.
Not at all.
Yeah.
Because you're relying entirely on your own cellular machinery to synthesize new proteins and assemble them into a stronger extracellular matrix, the tissue just needs time to do the work.
Right, so what's the timeline looking like there?
The clinical data shows that peak visible improvements, so, the measurable increases in skin elasticity, dermal thickness, and deep hydration, they generally appear within 4 to 12 weeks after the treatment is administered.
4 to 12 weeks, okay. And that biological delay really dictates the entire structure of the initial loading phase, doesn't it?
It absolutely does.
Because the standard clinical protocol across all the sources, whether we're talking about specific brands like Plynest, Amila, or Rejurin, it always involves an initial series.
Right, usually 2 to 4 sessions.
Yeah, 2 to 4 sessions, usually spaced about 2 to 4 weeks apart.
Because you're repeatedly hitting that update button on the software.
I like that. Hitting update again and again.
Yeah, because a single signal just isn't enough to overcome years or sometimes even decades of cellular dormancy.
That makes total sense.
By saturating the tissue with these messengers every few weeks, you ensure the fibroblasts remain fully activated throughout that critical initial protein building phase.
I want to pull in an analogy from the clinical notes from Dr. Chai Clinics here, because it just perfectly illustrates this initial loading phase.
Oh, the gym analogy.
Yes. He compares starting polynucleotides to going to the gym. If you lift heavy weights consistently for a few months, you build real, tangible muscle fiber.
Right. It's your own actual tissue.
Exactly. It's your own tissue. But if you stop going to the gym entirely, that muscle eventually atrophies. Your body slowly returns to its baseline.
Yeah.
So with polynucleotides, the initial sessions build real muscle for your skin. Actual structural collagen.
It's important to note, the collagen you build is indistinguishable from the collagen your body produced naturally in your youth.
Wait, really?
Yeah. It is your own permanent living tissue.
Okay, but let me push back on this concept for a second, because this is the paradox that was really tripping me up when I was reading through the journals.
Okay, let's hear it.
If I go to the gym, build the muscle, and then stop working out, the muscle goes away because it requires mechanical stress to maintain, right?
Right.
So if the collagen we are building with this treatment is real structural protein, why does the aesthetic result fade? I mean, if the body built the physical matrix, the matrix is there, why doesn't it just stay there forever?
That's a great question. It really comes down to separating the biological stimulus from the structural result.
Okay.
The collagen and elastin proteins your body manufactured are indeed real, and they are permanent. They don't just magically evaporate.
Right.
However, the stimulus, meaning those highly purified DNA fragments you injected to start the process, they are completely biodegradable.
Because the body recognizes them as a natural substance and metabolizes them.
Exactly. Your body has these naturally occurring enzymes in the tissue that are specifically designed to break down nucleic acids.
Okay, I see where this is going.
So over the course of a few weeks, those injected DNA fragments are fully metabolized and cleared away by your lymphatic system.
And once those fragments are gone...
Once they're gone, that continuous artificial signal telling the fibroblasts to overproduce collagen just goes silent.
The software update finishes running, the screen goes dark, and the factory basically goes back to its normal sluggish output.
Exactly. And we also have to consider the environment that factory is operating in.
Which is not a friendly environment.
No, not at all. The natural aging process hasn't stopped for a single second. Background UV exposure, chronological cellular degradation, environmental pollutants.
Just everyday life.
Right. All of these sources continue to actively break down collagen every single day.
So your fibroblasts have returned to a slower production rate, but the daily microscopic destruction of your skin's architecture is just continuing at full speed.
That is exactly why the visible aesthetic benefits eventually begin to soften. The new collagen is still there, but it's degrading naturally without being rapidly replaced anymore.
Okay, so if the body is constantly metabolizing these fragments and returning to a dormant state, there has to be a biological tipping point, right? A point where the skin needs another signal, or it just crashes all the way back to baseline.
Right.
So what does this all mean for the calendar? When are the clinical protocols saying you, the patient, actually need to intervene to maintain this structural integrity?
Well, looking across the dermatologist's consensus protocols and the data from clinics like Aesthetic Health UK and Berkshire Aesthetics, there's a pretty unified golden rule for maintenance.
Okay, what's the golden rule?
To sustain the benefits, a single maintenance or booster session is recommended every 6 to 12 months.
Every 6 to 12 months. And a lot of those practitioners seem to actively aim for the 6 to 9 month mark just to be safe.
Yes, that's very common.
It seems like the strategy isn't to just wait until you look like you did before you ever started the treatment.
Oh, absolutely not. Waiting for the results to completely vanish defeats the entire purpose of regenerative medicine.
Right.
The goal is active preservation. You want to intervene while the skin still retains a robust structural foundation from that initial loading phase.
So you're catching it before it falls.
Exactly. If a patient receives a booster at the 6 to 9 month mark, they aren't starting from scratch. That single session reignites the fibroblasts, sure, but it is building on top of the dense collagen matrix that was already established.
I think the clinicians refer to this as raising the floor.
Raising the floor, exactly.
I love that concept. Instead of your skin quality bouncing up and down from a low baseline, your absolute lowest point becomes progressively higher and healthier over time.
If we connect this to the bigger picture, it is a highly strategic way to manage skin architecture. Every time you time a maintenance session at that 6 to 12 month interval, you're compounding your results.
Building on top of previous work.
Right. You establish a cumulatively higher baseline. You aren't just holding steady. Over a span of several years, you are actively engineering a thicker, more resilient dermal layer.
Here's where it gets really interesting for me. Because if we're talking about doing this every 6 to 12 months, indefinitely, it begs a massive question for anyone familiar with traditional cosmetic injectables.
I know exactly what you're going to say.
Right, because if you go into a clinic every 6 months and pump more hyaluronic acid gel into your face, you are eventually going to hit a wall.
A very puffy wall.
Exactly. The product builds up and migrates, the tissue physically stretches to accommodate the volume, and you end up with that distorted look people often call filler fatigue.
Right.
But the journals emphasize that this simply does not happen with polynucleotides.
It doesn't. And this loops back directly to the pharmacokinetics we discussed earlier. Polynucleotides are messengers, not volumizers.
Right. They don't take up space.
Because they're completely biodegradable and cleared from the tissue within a matter of weeks by those natural enzymes, there is zero risk of physical accumulation.
Wow.
By the time you return for your 6-month booster, there is absolutely no product left in your skin.
The only thing left behind is the collagen your body produced.
Exactly.
So there's literally no physical maximum limit to how many courses you can have. You don't have to worry about looking overfilled because there is nothing left behind to fill you up.
You can maintain this 6 to 12 month cycle indefinitely.
That's why.
And the result will always read as natural health because biologically, it is purely your own natural tissue. You're merely supplying the biochemical prompt to keep the factory running at an optimal speed.
That is such a vital distinction. It's a long-term structural strategy, not just a quick cosmetic fix.
Precisely.
But, you know, we've been talking about the face as if it's just one uniform canvas that degrades at a constant speed, but that obviously isn't true, is it?
Not at all.
I mean, the skin under my eyes is completely different from the thick tissue on my jawline. So does that anatomical difference change how fast the body burns through the benefits of the treatment? Like, does the 6 to 12 month golden rule hold up everywhere?
The anatomy of the treatment area absolutely dictates the biological response, and the clinical protocols highlight several key exceptions where the schedule really shifts.
Okay, let's talk about those.
The most demanding area is definitely the periorbital region, the under eyes.
Which is historically one of the hardest areas to treat with traditional fillers, right? Because HA gels pull in water and can cause that long-term puffiness or swelling in the tear trough.
Exactly. Polynucleotides avoid that puffiness because they aren't hydrophilic, they just don't attract water.
Oh, that's a huge advantage.
It is. However, the skin under the eyes is exceptionally thin. It has almost no subcutaneous fat, it lacks dense structural support, and it is subjected to constant mechanical stress.
From blinking and squinting and all that.
Right, facial expressions. Plus, the cellular turnover rate in this highly vascular, delicate area can be significantly faster.
So the structural scaffolding you build there is constantly under higher stress and degrades much quicker than, say, the collagen in your cheeks.
Because of this anatomical vulnerability, the biological momentum slows down much sooner.
Makes sense.
Patients often notice a softening of their results earlier in the under eye area. So clinics frequently adjust the maintenance protocol here.
What do they recommend instead?
They usually advise a booster closer to the 5 to 7 month mark, just to keep that very thin tissue firm, bright, and adequately supported.
Okay, that makes perfect sense for fragile tissue. But
Oh.
what about the other extreme? Because the sources also mention treating things like acne scars and stretch marks.
Oh, yeah. That's a whole different ballgame.
Right, because that is incredibly dense, stubborn tissue. Does that require more frequent maintenance or less?
Interestingly enough, it requires far less maintenance, but a much more aggressive start.
Really?
Yeah. When we look at the BioRhesus protocols for dense fibrous scar tissue, the initial loading phase is intense. You might be looking at monthly sessions for 6 to 8 months straight.
Wow. 6 to 8 months of monthly sessions.
Yes. Because the goal there isn't just to build new collagen. It's to actively break down misaligned, rigid fibrous bands and literally force the tissue to remodel itself from the ground up.
Basically laying down an organized lattice of new protein.
Exactly.
But once you finally force that scar to remodel, it doesn't just like spring back into a rigid scar the moment the treatment stops, does it?
No, it doesn't. Once that heavy lifting is accomplished, the regenerative effect is remarkably stable.
Okay.
After that intensive initial phase, additional maintenance for scar tissue or stretch marks might only be needed every 12 to 18 months.
That's a huge difference.
It is. The structural change to that specific type of tissue is just much more permanent.
So the physical anatomy shifts the timeline, but, the sources put an enormous amount of emphasis on something entirely outside the clinic's control.
Yes. Lifestyle.
Right. How you actually live your life between these appointments. It sounds like lifestyle is the ultimate variable in whether you hit that 12-month mark or come crashing down at month 4.
The clinical outcome is truly a 50-50 partnership between the practitioner's needle and the patient's daily habits.
50-50.
We establish that natural aging and environmental damage constantly dismantle your skin's matrix. Well, your lifestyle determines the molecular speed of that dismantling.
Let's get really specific about the mechanisms here, because the sources single out UV exposure as a primary culprit. Why is the sun such a massive threat to the results of this specific treatment?
Well, UV radiation penetrates the skin and directly upregulates matrix metalloproteinases.
Which are commonly known as MMPs, right?
Right, MMPs. And these are basically enzymes that act like microscopic scissors.
Oh, no.
Yeah, they literally snip apart the collagen and elastin fibers you just spent months and significant money building up.
That is brutal.
UV exposure physically dismantles the structural proteins.
So going out and baking in the sun without protection is literally cutting down the scaffolding the polynucleotides just built.
Exactly.
And the sources mention smoking and chronic stress as well. How do those affect the timeline?
Smoking is terrible for it. It introduces massive amounts of oxidative stress and restricts microcirculation.
Meaning less blood flow.
Right, so it starves the fibroblasts of the oxygen and nutrients they desperately need to synthesize protein.
Okay, and stress.
Chronic stress elevates cortisol. High cortisol levels inhibit the production of hyaluronic acid and also upregulate those same destructive MMP enzymes we just talked about.
The microscopic scissors.
Exactly. Furthermore, poor sleep denies your body the critical nighttime window when human growth hormone is actually released to naturally repair tissue damage.
Man, so you're essentially fighting the software update while it's trying to run. You're asking your cells to build and then immediately throwing acid on the construction site.
That is exactly what you're doing. But conversely, if you actively protect the matrix, you stretch that maintenance window to its absolute maximum.
Now, how do we do that?
Daily application of a broad-spectrum SPF 50 is non-negotiable.
Rain or shine, indoors or outdoors, right?
Absolutely. Yeah. Furthermore, incorporating topical antioxidants, like a high-quality, stable vitamin C serum in the morning, that neutralizes the free radicals that trigger those destructive enzymes.
Got it. Vitamin C in the morning.
And using a stabilized retinol at night continues to gently stimulate surface cell turnover, while the deeper dermal layers are supported by the polynucleotide signaling.
It's like a two-pronged attack.
Exactly. When you combine the injectable treatment with optimized daily skincare, deep hydration, and restorative sleep, you create a protected environment for your fibroblasts.
Which buys you time.
It's the biological secret to extending the time between booster sessions to a full 12 months.
It requires a completely holistic approach then. You aren't just buying a result, you're investing in a biological process.
Very well said.
Let's pull all of this together and recap the mission for you listening right now. If you are diving into the world of polynucleotides, the secret to preserving those incredible initial results isn't just some magical one-and-done permanent fix. It requires a highly strategic maintenance schedule.
Right, a sustained long-term commitment to cellular signaling.
Typically, that means returning to the clinic for a single booster session every 6 to 12 months. This specific interval prevents your fibroblasts from falling completely dormant again.
It continually reminds your cells to act younger.
Exactly. Which creates a compounding effect, essentially raising the baseline of your skin's structural health year after year. And because these DNA fragments are completely natural and biodegradable, you can maintain this restorative cycle indefinitely without any risk of looking artificial, puffy, or overfilled.
This raises an important question for anyone considering this regenerative approach.
Oh,
Are you prepared to protect your biological investment?
that's the real question.
The 6 to 12-month schedule is the clinical gold standard, but your lifestyle is the ultimate variable. Are you doing the daily molecular work? Applying that SPF 50, prioritizing your deep sleep, actively managing your cortisol levels, just to ensure the collagen matrix you build actually survives.
Right.
The treatment provides the cellular blueprint, but your daily habits are the raw building materials.
Such a crucial point. It's a literal partnership with your own biology. And while that leaves me with a final kind of mind-expanding thought I really want you to mull over.
Okay, let's hear it.
We've spent this entire deep dive talking about polynucleotides in the context of aesthetic clinics, dermatology, and cosmetic enhancement. But think about the underlying mechanism of what we are actually doing here. We are injecting purified DNA fragments to give our cells the exact biological instructions they've forgotten how to send.
It's incredible when you frame it like that.
We are manually triggering cellular repair and fighting tissue degradation at a molecular level. So the question is, as this technology inevitably advances, at what point does a routine aesthetic booster every 6 months cross the line from a cosmetic beauty treatment into fundamental preventative cellular health management?
Oh, wow.
I mean, are we just treating wrinkles and skin laxity, or are we quietly learning how to actively maintain the hardware of the human body?
It forces a profound shift in how we view the biology of aging itself, really.
It really does. The biological software update is available. It's just up to us to click install and keep the system running. Thank you so much for joining us on this deep dive. We'll catch you on the next one.